Although the number of cases is rising and we keep hearing these warnings, a new poll found that 78% of Americans say they're not concerned about getting swine flu. Are we doing enough? Let's go right now to Atlanta. Dr. Richard Besser is standing by. He is acting head of the Centers for Disease Control. And Dr. Besser, thanks for joining us this morning. I want to turn to that 78% of people who say they're just not worried they're going to get it. What do you want to say to them this morning?
Well, you know, I think that it is time for people to pay attention, for people to do planning and to understand what they can do to prevent the infection. And you were just giving great advice for things people can do. In addition to the things you mentioned, I would want to include that if you're coughing, don't cough into your hand, cough into your sleeve or your elbow. And if you're sick or your children are sick, don't send them to school and don't go to work.
But Dr. Besser, we keep hearing that advice as the number of cases continues to rise, the number of states continues to increase. And I think a lot of people think there's a disconnect here. Let me ask you this. At what point, how high do the numbers have to get before you will say to the rest of America, keep your children home from school, as the 160,000 already are, and not go out into big group events, for instance? At what point does that trigger?
You know, this is a period of great uncertainty. It's a situation that is evolving rapidly. And we are trying to study the impact of school closures on control of this as they're taking place, because that's a critical question. We want to make sure that school closure is, in fact, decreasing risk of spread in a community and not taking children who would have been at school and sending them out to malls and other places. We want people to be planning, thinking about what they would do if their school closed. The goal is not to send children out in the community, but to decrease some of the contact.
If you're that worried, why not just take the biggest preventative action that you could take?
Well, you need to think about each action and whether or not it will have the intended consequence. There's been discussion about why don't you close the borders? Won't that help? Clearly, the information we've had from SARS, the information we've had from modeling, and our planning would indicate that there would be no added value from that. We want to make sure that what we tell people to do would have a high chance of success, and that the consequences, the negative consequences, wouldn't outweigh that.
We know the president said that it's already here, so that's sort of closing the barn door after the horse has already left. Is that the right metaphor? I think I'm close there anyway. But 600,000 people are coming from south to north every single day. At what point would you bring in those sensor devices that would measure whether somebody had a fever or not?
Those are not very effective, especially for an infection where you are able to transmit if you're infected the day before you have symptoms. That kind of screening can be useful for something like SARS, potentially, where you are not able to transmit the infection until you're quite ill. An infection that has an incubation period or a pre-symptomatic period where you can transmit doesn't give you that same opportunity.
All right. Well, Dr. Besser, we thank you for joining us. We know it's day by day, and we're going to continue to provide everybody the information that we have. And you can go to our website. We always recap it there. It's abcnews.com, the very latest.